Sitting on the sideline was probably one of the worst things, like watching your friends do and play the sport that you love was tough.
My job was to perform surgery well and then help her get through the experience. And one of the important things that I felt I needed to do for her was control the pain post-surgically. I did not want to expose her to opiate medications. I did not want her to have the complications from opiates, and I certainly did not want them to play a role in her mental well-being.
I mean, I could have been in a lot of pain after surgery, like a lot of my friends were and my sister was. My recovery process could have been different. Maybe I wouldn't have been able to walk to the bathroom 24 hours after surgery. Maybe my rehab would have been minimal, not as great as it should have been.
We used EXPAREL into her wound after surgery, and she did fantastic. She took no opiate medications after surgery and made every step of this look easy. Well, be clear, it is not even close to that.
My knee still gets sore after hard training sessions or a hard conditioning workout, but I'm good. I'm on the field, I'm playing, I'm healthy, so that's all that matters to me. It helped me, so I'm hoping that it would help other people.
It's that pain in your knee that doesn't go away. I love being active. I love spending time with my family. I love walking. I love being active outside. I could do it, but then I pay the price the next day for doing that because my knee will be on fire. I want to do all the things that I love doing without having to pay that price the next day.
Rod scheduled an appointment to discuss his options with orthopedic surgeon Dr. Chad Hansen.
When Rod came to me, we discussed his knee osteoarthritis. One of the main reasons that I wanted to use ZILRETTA on Rod is that he wanted a medication that would work well, that would reduce his knee pain, and that it would last for an extended period of time. And he also wanted to avoid surgery.
I felt disappointed. I couldn't participate. Especially like during the summer, you can sit down at a picnic table, sure, but if you want to go out and throw a football or whatever with the kids, you can't do it because you're hurting so much. Relief was pretty much instant. Your knees is not throbbing like it was. When Betty saw me come home that first time, a smile on my face and everything. I mean, it was like, hey, I'm here. What can we do? So she saw a definite improvement. I don't want any more surgeries. I want that iovera and go on with my project.
I used to love playing golf with my daughter.
Nice shot, kiddo.
But the pain forced me to become a spectator. I was tired of being sidelined. So I talked to my doctor about iovera, a quick procedure that freezes the nerves causing pain. iovera is FDA cleared and provides immediate relief for up to 90 days. Now I'm back doing the things I love with the people who matter most. Visit iovera.com to learn more.
There are now techniques where you can numb the nerves going to your leg, and you can use long-acting medications that are safe and effective for 2, 3, sometimes 4 days. Simple medications that are not opioids, which really makes the recovery so much better. And a good example of that is EXPAREL.
My experience on my second Achilles surgery with EXPAREL was fantastic. I did not want the pain. I did not want the opiates. EXPAREL made all the difference.
Paula enjoys doing things. You know, she lives a very active lifestyle. And so after the knee injury, she became kind of like on the sideline. And for a long time, she was out of the game.
When you have that kind of pain, it's almost like you're facing your mortality. This is what it's going to be. I'm going to be confined to just sitting and observing instead of participating. That was the hard part, was just feeling like I had lost a certain part of my life because of my limitations before surgery. At that point, I was willing to try anything that was going to give me some relief. Iovera brings relief to people in pain so that, they don't lose out on part of their life because they can't do certain things. It's exciting to know that you can have a treatment like that is non-opioid and get relief and resume, your normal activities. If I had known about this before my surgery, I would have elected to do this and postpone surgery because I just had such instant relief from it.
Over the years, I've played a lot of sports and activities, and I really didn't want surgery. When I first spoke with Jason, he said there were several options, and one of the options was a long-acting steroid. The one thing that really pushed me to seek treatment was the fact that the relief that I've been told it could produce was an opportunity to try to get something back.
I can't wait to get this surgery over with.
To get through those first few days without worrying so much about my pain.
For this to be behind me. I can't wait to walk my dog.
To smile.
To wear my yoga clothes again. To get back in the garden.
To feel like myself again.
For life to get back to normal.
Having a pain plan you trust can't wait, and neither can getting back to your life. As you plan for surgery, ask your doctor about EXPAREL, a single-dose non-opioid pain relief option given during surgery that lasts for the first few days after surgery for a smooth recovery, so you can get back to what you can't wait to do. EXPAREL is given during surgery by a doctor, either into the surgical area or nerve block for adults, or into the surgical area for children 6 years or older, to help reduce pain after surgery. Consult your physician to determine if EXPAREL is appropriate for you or your child. EXPAREL should not be used for certain childbirth procedures.
I can't wait.
I can't wait. I can't wait.
I can't wait for you to feel better.